everyone. Thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. And Dr. Yaffe is here today, so I'll turn it over to her for some brief remarks.
Thanks very much. Good afternoon, everyone. Unfortunately, we do continue to see our daily case numbers rising. Today, we're reporting an increase of 425 new cases in Ontario. We haven't seen these kind of counts since early June. While 75% of our new cases today and 64% of our cases yesterday are in Ottawa, Peel, and Toronto, there are other health units, other jurisdictions across the province that have been seeing an increase in their numbers as well. In particular, this includes other regions in the Greater Toronto Area, such as Durham, York, and Halton, as well as the Waterloo region. The recent cases, in fact, 51% of recent cases, continue to be primarily in the 20 to 39 age group. When we look more closely at the numbers to determine where these individuals are acquiring the virus, we have seen a few trends emerge. Social events remain an issue. Weddings, house parties, and so on contribute to our case numbers. We've also seen a rise in workplace infections. This does include some in restaurants and bars, although the infection has tended to circulate more often between the staff in the workplace rather than the patrons. We're finding that in some cases, work colleagues assume they are in each other's social circle because they work together, therefore making it safe to interact without physical distancing or wearing a mask. This is absolutely not true. Unless your colleagues are in your social circle of up to 10 people, you must keep your physical distance or wear a mask if you're not able to do so. We've also found that many individuals are going to work when they don't feel well. I cannot stress enough how important it is to stay home if you are experiencing any signs or symptoms of COVID, no matter how mild they are. With the rise in cases and the circulation of the virus in the community, it is no surprise that we are seeing cases in our congregate settings, including schools. In total, the Ministry of Education has noted a total of 90 school-related COVID-19 cases in Ontario. 18 of these are newly reported today. Of the 90, 33 are among students, 26 among staff, and 31 were not identified as staff or students, so we're not sure which one they were. The details were not provided for privacy reasons. In total, 3 schools have declared outbreaks, and 2 of them have been closed. The COVID-19 cases are currently involving 75 out of almost 5,000 schools in the province. As we continue to see the numbers increase, I want to continue to remind everyone of the basic public health actions that you can all take to keep yourself and those around you safe. Wear a mask where required or when you cannot maintain your physical distance. Stay home when you're sick. Stay 2 meters or 6 feet apart from those outside your social circle, and wash your hands regularly or use hand sanitizer. This is also a good time to really take a step back and think about your social circles and your social interactions. Are you keeping to your social circle of 10? Do you really know how many close contacts you have had in the last 14 days? Are you wearing a mask when you cannot maintain that social distance? These are all things we must do if we are to control the spread of COVID-19 in Ontario. Thank you. With that, I'll open it to questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Ashley Legasic with News Talk 1010. Please go ahead.
Hi there. Thank you for taking my question. BC has just taken a number of symptoms off of their daily screening checklist for students. They no longer ask about sore throat, runny or stuffy nose, headache, rash, fatigue, and several others. Does our province have any plans to change the current health checklist for students?
Yes, thank you for the question. We're aware of the changes BC has just implemented, and we will be working with Public Health Ontario to look at the most up-to-date data and the data that BC used for making that change to see if we need to make a similar change in Ontario.
Follow up?
Thank you. And my follow-up will be concerning holidays. It's now been 2 weeks since the Labor Day weekend, and we are in fact seeing a spike in cases. Our next long weekend will be Thanksgiving, which could pose some more complications. It'll be colder. Families will be inside together, cooking, sharing food, getting close. For a lot of people, it's one of a few times a year they see their family. So what's the plan for this holiday provincially? How are we going to avoid another spike when we know there will be get-togethers?
Well, I mean, we have the same advice that we've been giving. I think people are aware that, certainly COVID-19 is still here. The numbers are going up. We have reduced the number of people who can get together for social gatherings now to 10 inside, 25 outside. And those 10, just to be clear, I know people are confused between the social circle versus the 10 social gathering. You can get together with the people in your social circle without wearing a mask and get close to them and so on. If they are not in your social circle, you can get together with them, but you should stay 2 meters apart or wear a mask and wash your hands, and you do other measures to prevent transmission. So I think people need to plan ahead for the holiday and realize that if it's going to be something inside, and if the weather's cool, obviously it may have to be inside, they should really think carefully about who those 10 people should be and can be, and what measures they need to put in place to keep everyone healthy.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, doctor. I wondered what the reproductive number is up to now.
Hi, Rob. I don't have the overall number. I know it varies now by jurisdiction, and it's definitely over 1. I think it's around 1.3 or 1.4 in some places. So I can't tell you exactly. I haven't got that data. But it's something that's monitored every day very carefully across the province and by jurisdiction.
Follow up?
Okay, and just another number question. This might be something more likely have. What is the percent positive rate we're getting on all the testing now?
It's around 1.5%. The last, I think yesterday, the labs did close to 32,000 tests, and the percent positive was 1.5. So the percent positive is slowly creeping up.
Next question.
Your next question comes from Antonella Artuso with the Toronto Sun. Please go ahead.
Thank you. Hello. The daily numbers that we're seeing now are similar, as you mentioned, to what we saw in early June, some in May, some in April, yet we're not in the same stage of lockdown. So I'm wondering what the difference is now, and could it be partly that we are looking at more outbreaks than community spread right now?
Certainly we are seeing outbreaks in particular either social gatherings or congregate settings, and each of those is dealt with very expeditiously by the local health unit, of course. We are looking at how do we, in a comprehensive way, address any potential further restrictions based on the epidemiology of the infection, the number of cases, the rates, the trends, both locally and regionally and across the province, looking at the capacity of the public health unit and the health system capacity. We don't want to go back to where we've stopped all surgeries, and we've got a huge backlog of surgeries, people with other significant health conditions that need to be dealt with. On the other hand, we do have to take appropriate measures to mitigate the spread of this infection. So we're looking at coming up with criteria where we would be able to say, okay, if these are the conditions, perhaps we need to address concerns in long-term care or retirement homes or other congregate settings or certain health units. So this is something we're working on and looking at the data consistently. So You're right, we're not going back to stage 2 holus bolus, but we are actively considering other measures.
Follow-up?
Yes, thank you. You mentioned that there are workplace infections. Many employees are starting to return to their workplaces. So what sort of infections? Is it just like in very busy situations like in a restaurant kitchen, or are we talking about regular workplaces, office workplaces? And if that's the case, what is your recommendation to employers in terms of keeping their employees apart or maybe allowing some to still stay home?
Well, I guess it depends on the workplace, but the Ministry of Labor has put out some very specific guidelines for different kinds of workplaces. So I would strongly recommend that the workplace, the employer or the person in charge check the website of the Ministry of Labor for guidance specific to that kind of workplace. Obviously, screening is very important, and being careful that people shouldn't be coming to work if they're symptomatic. Trying to keep people in cohorts so that if there's a case that we know who they've been exposed to or exposing. I think instructing people around breaks. I think, it's one thing when you're doing work, but when you're taking a break, sometimes people can let their guard down and start to socialize or eat, at a lunch break or whatever, sit there with their work colleagues and not think about that they still have they have to distance from those people. If they have to take off their mask to eat, obviously, but they can't be close with those people. They're not, unless they're in their social circle. And having good hand washing facilities accessible, all those basic things have to be in place, and being clear that if people are not feeling well, they should go home. But in terms of whether people should stay home or go to work, that's a workplace decision.
Next question.
Your next question comes from Allison Martell with Reuters. Please go ahead.
Thank you. So Ontario's pending tests are almost always less than the new results, suggesting that tests aren't sitting in backlog for more than 24 hours. But if you look at Toronto's dashboard right now, it says that only 25% of tests are turned around within 24 hours. So I feel like there's something I'm not understanding about the math here. How do we define a pending test?
A pending test means that the result hasn't come out yet. So it doesn't, I don't think it's by time. It's just that the result hasn't come out yet. We do, the aim is to get tests within 24 to 48 hours. That is the aim.
Follow-up?
In processing time?
Yeah, correct.
So what is the median processing time?
Oh, what is the median processing time? I believe most of them are within 48 hours at this point.
Next question.
Your next question comes from Ezra
Belote with Radio Canada. Please go ahead.
Thanks. Hi. I work in Sudbury, Northern Ontario, and my question is about the Alert app. And the app has been here for a while now, and I'm just wondering, how reliable do you think the app is in regions like Sudbury, understanding, that the app works best if you have many users. So have you any idea of its efficiency in, overall and in smaller regions? Thanks.
Yeah, we're certainly still promoting and hoping that more people will go on to the app. I believe something like 2.5 million people have gone on, and I don't have the breakdown by different regions, but I believe it's over 2 million for Ontario. You're right, the more people go on, the better it will work. So, I don't have the breakdown for Sudbury, but I know it's something we are very much advocating people go on. There are no privacy concerns with it. It cannot identify you or where you were. It's literally connecting your phone with someone else's phone. And if you become positive and you put in that, your lab number, which is an anonymous number, the app will identify and signal to other people who were potentially in contact with you that they were contacts. So it's a very good way for people to get informed that they were in contact, and then they can call the health unit and do whatever's appropriate at that time.
follow-up, and this is the last question.
But if I may, the issue is that the app doesn't take your position. So it's how can we get the data to make sure that certain areas people are using it or not? Because as you said, we don't take the geographical position, so it's really hard to understand how the app is reliable.
Yeah. I'm certainly not an IT expert, but I understand the phone. If you have the app on your phone, the phone then gets a signal if another phone with the app is within 2 meters, and gets that signal. So then, if you put in that you've had COVID, every phone that had that signal gets the message they have been in contact. So it doesn't matter if you're in Sudbury or Toronto or wherever you are. It's the proximity of the 2 phones that have the app on them.
Thanks, everyone.
Thank you.